Hello, everyone. Happy Thursday afternoon. I'm Dr. Drew Ramsey, and this is the Brain Food Vlog. We are going live every Thursday with someone to try and help feed your mental health, feed your brain health. And so we'll let everybody gather for a little bit, and I just want to tell you about the very special guest that we have today. Austin Chung he's an advanced endoscopist, and he's going to tell us all about that. But he's got more training than I guarantee you. He's got more training than anybody watching. He's also the president of the Association of Social Media, of Healthcare Social Media. And so he's a real just innovator and expert around how do we think about social media in medicine. And so I am very, very excited to go live with him here in just a second. Austin is at the Jefferson Medical Center and Jefferson, I think, University. Hey, Austin. I think if you just asked to join. And he's on the faculty there. He trained at Duke, at Columbia, and at Harvard. And so I'm so excited to have you come along with us as we talk about all things social media and mental health. Hey, Austin.
Hi, how are you?
I'm doing very well. I realize, we're getting you probably just right out of the OR. Is that right?
Yeah, so I'm in my office right now.
Oh my gosh, are you all right? Do you have a beverage or a snack? I feel like you've been doing advanced endoscopy all day.
Oh, I'm good. I'm used to it.
I'm sorry that I have this mask on. The reason
That's
I have
okay.
my
Just
mask
took mine
on, I
off.
just want to remind everybody out there to wear masks. I think we have COVID in our house after having a strong quarantine game. And maybe it's also a tribute to you to be a responsible physician on social media. So, hey, everyone that joined, I'm Drew Ramsey. This is Austin Chung. He's MD, and as I mentioned, he's here to join us. So, Austin, let's get started. First of all, I just want to check in, how are you doing? How's your COVID experience in quarantine going?
Good, not bad. I'm in Philadelphia, so things are pretty much, back to normal in terms of hospital operations. So, we're doing okay here.
Even with that, does it still feel, everybody's in a lot of PPE, everyone's getting tested, or does it feel to you like, you're back in the OR, life feels relatively, like we're getting through this?
I think that we are definitely taking all the necessary precautions, and we always have throughout this entire pandemic. So, we're still very aware that it's an issue, and we still have patients who, there are patients in the hospital who are COVID positive. So we're still very, aware of that.
Maybe it feels like there's an adjustment where it's, I wouldn't say the new normal, but
Yeah.
one place where healthcare has been innovative is, people are still getting sick and need our care. So will you tell us a little bit, just tell everybody what an advanced endoscopist is?
Yeah, so it's a subspecialty within gastroenterology. So what I do is more focused on complex procedures, especially related to the pancreas or the bile duct. And also, I also in particular help out with weight loss procedures with bariatric endoscopy. So these are procedures that are done through the mouth and not through the skin. So they're a little bit different and more novel. They've only been in existence for probably the past decade or so. So it's an exciting new field.
It's super exciting, I think, because there's so much, I think, fear around surgery, kind of like mental health. People don't want to go under the knife. And then also,
Yeah.
I think, there's such a obesity in its treatment is so, I would say, also stigmatized and just not talked about. So people don't know all the options like this. So you go in through the mouth, and I've seen on your Instagram, some of the procedures, and I think you're probably the only person on Instagram and on social media who's an advanced endoscopist.
There are a few. There are a few.
Okay, I just want to know I'd like you to share with everybody a little bit about, I would say how you use social media. I guess I'd ask how you're so good at it, but I think that's not a fair question. But how you use social media in a really advanced and technical field like advanced endoscopy.
Yeah, I think one of my goals, I have several goals with being on social media, one of which is putting out accurate information. But the other thing is, because my field is maybe less well known than some other fields out there, to really help bring more awareness to the conditions that we treat, and also some of the procedures that we offer that, people might otherwise not know about. So, I try to really explain things in terms that are easily understood, and especially with some of the newer social media platforms, I try to do it in a more entertaining way. And
You're very entertaining on TikTok. My book agent told me like, I should get on TikTok, and I was like, I don't know.
well,
But
Instagram just rolled out the sort of
is that
competitor,
Reels? Is
like
that what it is?
equivalent. Yeah.
All right, I'm going to get some coaching for that maybe at the end of this Instagram live. Well, everybody watching, everybody's obviously on Instagram who's watching. And by the way, hey, everyone who's just turning in, this is Austin Chang. He's an advanced endoscopist and the president of the Association for Social Media and Healthcare. Both of them have Instagram feeds, and so check them out. And I want you to tell us and just give everybody a little advice. If you're going to use social media more effectively the next couple of weeks, what's a couple of things of inspiration in terms of, I would say, one, making great content, because you consistently make strong content. What's a couple of tips you have for people to just improve their content?
I think that for people on here who are creators themselves, I think just being genuine and being like sort of talking about what you're going through. I think that fabricating any sort of experience never comes across well. And I think engaging with other people on here is really important. That's always been kind of how I've approached it, is that social media is an extension of, who I am and what real life really is, and the connections that you make on here and the network that you develop is really a real network. These are real people on the other end. And so keeping that in mind, I think, is always important.
Yeah, you're one of the people, like, I met you through social media.
Yeah,
like
exactly.
Talking, right? and I'm
exactly.
really happy to know you, and you've had an influence on me. So I think that is something that, in terms of during quarantine and COVID, I feel like we're valuing much more because there's no other option. But then I think also seeing the power of it. So make genuine content and be accurate. I think those are great pieces, and have fun. That's the other thing I think that I like, and I feel I share with you, is that you should be having fun with it in terms of. It can always feel like a burden, but enjoy it. Tell us about the Association for Social Media and Healthcare, if you would.
Yeah, so this actually was founded about a year and a half ago at this point by myself and some of the other doctors here on Instagram, actually. And the whole idea came about because, and this might have been when we met, but the whole idea was a result of this campaign that we had run called Verify Healthcare. And the idea was that, there are some people on here who might be putting out information that's medical, but they're not really experts in the area. They don't have the credentials to back it up. And so we wanted to help our followers understand how to look up people who are board certified or true experts in their area, as well as, have people on here who are sort of in a position to disclose their own credentials to do so as well. So that's really how it came about. But then we focused also on a lot of other issues that I think we became concerned about, or that we wanted to help other people understand how to use social media better. So essentially, if I could sum up the organization in one sentence, it would be to help other health professionals use social media effectively, but also responsibly.
I think that's such a key part, because I think medicine's been scared of social media.
Yeah.
And we've lost a step in terms of...
and there's always been this disconnect with how people are, we're spending so much time on social media these days, and we're exposed to so much. And so, why don't we use it as an instrument for good, for education?
A great delivery vehicle. We've always had a hard time with patient education in healthcare. We don't make our stuff very interesting. It's like a handout, and oftentimes a fast doctor's visit who, you're worried about different things, and there's not a lot of maybe concrete good advice or inspiration or recipes or I don't know, all of the things, or entertaining videos that engage people in things, like advanced endoscopy procedures, right? Where most people have never even thought about that. And now you get to, I don't know, show it off in a way that's just, well, that's great. And everybody, you should check out the organization. I joined, and I think it's wonderful because I think social media is a wonderful tool. I was very happy a couple of years ago. I encouraged the EPA to join Instagram, the American Psychiatric Association.
Uh-huh.
And as psychiatrists, we're really shy on the social media. Like you're not supposed to know anything about us.
Right.
And it's really been exciting to watch that grow and to watch mental health kind of step into social media a little bit. Will you tell us a little bit about kind of how you transition between leading organizations and being on social and being in the OR and
Yeah.
having a social life? I mean, how do you go kind of between all those parts of your life? Because I think so many people watching do that.
Yeah. I mean,
And
I have
you seem
always
to do it
been a
very
lover.
well.
Well, I've always been a lover of social media. And so that's what I do in my free time anyway. And I think that, that's when I sort of made a conscious decision a couple of years ago that I'm going to really use it productively, because I'm spending all this time on social media anyway, scrolling aimlessly. And so why not kind of use it in a way that it's kind of extending what I do on a daily basis, and I can feel good about the time that I'm spending on social media.
It's like the ultimate treatment for screen addiction. It's like, no, this is helping, right?
Yeah,
It's
this is actually, productive now.
yeah, it's I think that's I think that is part of it. I think the other thing in terms of how healthcare providers can use social media, there is something around forcing you to produce content and to think about the environment around you, both in the simplest way of using Instagram, what's beautiful, right, to influencing just those people. If you're a healthcare provider, everybody in your community that follows you, maybe you're not a big influencer like Austin, but they look to you for advice. So many times we hear from our patients, right? My friend's a nurse, and I saw on her Instagram. And so it's a great way, I think, for all of us in healthcare to really to do a better job leading and sharing and showing what we do to keep people healthy.
Yeah.
And then it allows us as somebody, as Nesrin Taviet says, right, guilt-free social media use. And it's not totally guilt-free. Like, I get hassled by my children, but
But really, I think it's also, with like the pandemic, for instance, I think that sometimes there's information that's put out there through third-party, media outlets, and the people who are reporting it aren't necessarily health experts. And so things get lost in translation. And for us who are on the front lines, or, experts in various areas related to the pandemic, whether it's infectious disease or like epidemiology or whatever it might be, it's, they can take the narrative back and really present the information themselves, so there's not as much, lost in translation.
I think it also forces you to clarify your positions, especially on controversial things.
Yes.
Right?
Yeah.
You have to take a stand, and there's a lot to think about, like med bikini.
Yeah.
One of my talking points is I try to teach people about social media. I'm part of the old guard, so I was like on Twitter, like having we had a grand rounds, like how to use Twitter. It was like but one of the rules, sort of not rules, but I guess ideas was don't drink, keep your shirt on, this kind of stuff. But as I think about that, how we define professionalism is really shifting in a way that I kind of like, because it feels like it frees us. And
well, so I've never like believed in the idea of separating professional content from personal content. I always felt like part of our job on here, if we're gonna, put ourselves out there as physicians, I think that it's really to show our personality and be more relatable and show that we're not robots and we're not just, really distant. Because I feel like we share the same struggles and interests as everyone else, and to showcase that.
I mean, I just think that I remember so often there was residents were getting taught, like, so the privacy settings on your Facebook are really important. Mm-hmm. And I'm thinking, we got to lose this notion that people can't know about you. Right? And that I think it's so stigmatizing. I think it's promotes so much burnout in healthcare, because there's like so much shame. Like, now it's kind of okay. But like when I trained 20 years ago, if you had a tattoo, it's like, ooh, like, are you antisocial? And now it's just like we allow people to be more of who they are. And I think that's good for all of us.
Yeah, no, times have definitely changed. And I think that, and I'm glad a lot of these topics are are surfacing now, with Med Bikini and that whole idea that somehow people shouldn't dress a certain way or look a certain way. I just think it's ridiculous.
So I like that. That another way to think about it is, you're a healthcare provider that holds you to certain ethical standards,
Hmm.
but you're allowed to do a lot of things maybe that, when I think about who defined professionalism in medicine, at least in the U.S., and I know we have folks. I just want to say, hey, I mean, people from all over the world are chiming in, Austin. So there's also like, I don't know, there's always a crazy moment I think on Instagram Live. I think we're connected to healthcare providers all around the world, so that's just very special for both of us. So hey, everybody. But people are just really resonating with us. We're not robots; we're all humans, and
Hmm.
allows us to express that and think about that and see. I think it also makes medicine more real and friendlier. But what do you think?
Yeah.
I mean, professionalism in medicine was like probably defined, let's just say, by lots of white straight men.
Hmm.
And
Yep.
so, do you think that this really this what's happening is, first of all, how much do you think that's going to change in the next 10 years, and what do you think medicine is going to begin to look like?
I mean, I really hope that it starts to change. I think there's a lot more awareness about, what leadership looks like and who's on the panel. And, I think that especially in medicine, where I think we are particularly sensitive to these sorts of issues, I would like to see that there's more change. So I hope that in 10 years we're going to see some progress.
I hope so. I mean, that's what we said 10 years ago, and it kind of
Yeah.
sometimes feels a little bit like COVID. Like we just all wore masks and we're really good for 2 weeks, let's say 3 weeks, it would be over. And it just feels like we all just really decided we'd confront, the racism and sexism and homophobia that exists in healthcare, that it could really end quite quickly. Maybe I'm feeling a little too optimistic on this Thursday, but I don't know. It feels like we're making a lot of progress. I'm curious how you keep your mental health steady and what sort of tips you have. I know that's a personal question, but I'm a psychiatrist, and
Yeah.
I'm curious about how you keep your mental health good, and I'm also really curious about what you eat. So you can, and everybody who asks what we're talking about, this is Austin Chung. He's a just he's an influencer. He's a advanced endoscopist at Jefferson in Philadelphia, and he's the president of the Association of Social Media and Healthcare. So tell us about how you're keeping your mental health in a
Mental
good
health.
spot.
You know, I'm gonna be honest, I don't feel like I'm always the best at it.
Okay, that's good. Me either. Okay, I think at everybody else, let's just have like
Yeah.
little. None of us have this.
Yeah. I think that I'm pretty hard on myself, and I feel like there's a constant expectation that like I shouldn't be taking time for myself. I feel like somehow that's ingrained in medicine, especially.
Mm-hmm.
But try to take those moments. It's not as easy now that there's a pandemic and we're sort of restricted to, you know, um, social distancing and et cetera. But I really like to take advantage of the surroundings and try to explore. And I'm a huge fan of just like, finding new places to eat and finding new things to watch and learning all the time. And so, kind of separating from myself a little bit and just like learning about other people's lives, I think is fun, which is why social media comes in handy because you kind of get a glimpse into what other people are doing all the time. Um, and then, yeah, I think in terms of mental health, there are definitely moments where I feel like I've gotta pick myself up again. And one of my, I guess, strategies is just talking it out. And I'm the type of person who likes to talk things out with my friends and people I know. I'm pretty much an open book to those I'm closest with. So I'm always venting and, hashing it out. And even like with people here online, I do that a lot too.
Yeah.
Um, and just having a conversation and not bottling all those feelings up, I think is really important. So when people ask me, when I go live on the various platforms, people often ask me like, what do you do to decompress? And I say, I'm here, like this is what I do to decompress.
I think it's also, yeah, it's one of those maybe pieces of social media that the piece of social media that people don't talk about is the way that we can use it to kind of express our opinions and get, kind of get rid of some agita. Well, this sounds like not the worst self-care plan. It sounds like you use Instagram in a lot of ways, but it does sound, doctor, you need a little bit better of a self-care Saturday. I like the wander and eat. I think that's a great one. And I
Okay.
like the kind of mindfulness of adventures and enjoying your surroundings. But there's something
Okay.
in there, Austin, that I'd like you to work on. I'm not sure exactly what, but a little,
Yeah.
you know, I know you're going to find just the right thing. And I'm curious about eating. I mean, you're in there, right? So I mean, like, I kind of wish you could send your scope and take a peek and just see how things are going down there for me, because, but that must influence what you eat. And so I'm curious, what do you eat I don't know, take good care of your health?
Oh my gosh, I'm also not the best person to ask about that. I'll be totally honest with everyone here.
Please, I think we said
But
authenticity. I mean, that's
part of my job, I think, is a little not conducive to like great eating habits. But I will say that I think that I try to make healthy choices, especially this with the pandemic. I've been forced to kind of, eat at home a lot more and, do my own grocery shopping. And that's made me much more conscious about what I'm putting in. And so, yeah, I think that, I don't follow any sort of specific diet. So I don't have, I'm not vegan or pescatarian or anything like that. So within that sort of those boundaries, I try to still make healthy choices and pay attention to like
you're such a doctor when you talk about food. You haven't I don't mean to be, you haven't
oh,
named
like
a single,
specific things.
you haven't said a food. I think it's, well, I only
Oh,
say that because I'm a nutritional psychiatrist. And one of the
oh, okay,
reasons that I
okay,
kind of got interested in that is when we talk about food and medicine, we talk about nutrients.
yes,
And then we don't say, I eat beans or pasta. We don't kind of make it
oh,
specific in a way. And so I'm sort of, yeah. And so I'm not. I don't mean to call out your not so healthy eating habits, but just more sort of like, when you're trying to eat well, what are the kind of foods that are, and in some ways, are informed by your practice? Because it may be,
sure,
I guess everybody's all cleaned out when you see them, but it just feels
sure.
like, you see a variety of eaters on the inside, and not many of
Yeah,
us do.
yeah, no, I mean, I think that the obvious answer to 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 that is like eating fruits and vegetables, and I'm a big fan of eating fruits and diversifying what I'm eating in that regard. I will say that my favorite sort of thing, whenever anyone asks me what my favorite food is, I always say like pasta and noodles, which I eat in moderation. Um, but yeah, no, I think that especially like whatever is in season, I think I go with that.
So
And
like a veggie noodles kind of dish is a standard. That's a favorite thing for you to make.
yeah, totally.
I mean, I think that's a very good one. I don't think pasta is not necessarily healthy. It's just not nutrient dense, and you put all those
Yeah.
veggies in. And favorite protein sources? Are you looking for seafood? Are you looking for, I don't know.
I do it all, honestly, but I do like tofu and I like chicken and yeah, I try to diversify.
Um, Yeah, that's good. Diversity is good, and I think to me, sounds like this can be, part of some of that self care. I like the idea of you getting encouraged to take a little bit time for yourself and not feeling like you need
Yeah.
to produce. One, because it seems to me from the outside looking in, you produce so much. Now we have gotten a couple comments and questions, and someone asking they want to hear from a psychiatrist on how to deal. And I think this is part of what us and I are talking about is both as clinicians. I think both I just did a full day seeing patients, and so do you. We do very different things,
Yes.
but part of the dealing is I think using social media and screen time for good, not evil, both for the self and for other. And if you just tuned in, Austin gave some great sort of tips and ideas on how to be more effective in social media. One of the reasons I wanted him on is he's one of the few docs who's on TikTok, and if you're, I don't know, I mean, I think that's just a great. If I guess I'm talking to everybody out there, if that's something that you're good at, I just want you to hear my encouragement and our encouragement to do that.
I mean, it wasn't in my comfort zone to begin with, but I got used to it and I got used to doing, some of the things that I do on there. Like the dances, people often ask me like, did you have formal dance training? I was like, no, I didn't do any of that until I got on the app. And I will say that screen time is, yeah, using it positively is great, but then at the same time, I can see how it can also affect you negatively if you're not careful. I think that there's a lot of these metrics that people pay attention to, right? Like the numbers of followers and the likes that they get and views and things like that. And I think if we get too bogged down in those things, then it can really have a negative impact on someone. I feel I've been in those situations before where I feel like I'm paying way too much attention to that. And, you know, when something doesn't perform as well
Oh
as
yeah, that one's
used
hard.
to,
I
then
always feel
yeah,
that my mental health's in a good spot when I just put it up and I don't care. And
yeah,
I hear some of those influencers like a Gary Vee who's always saying, it's like, it's your job to make content. Like, be you, speak your truth, and whatever you
yeah,
feel comfortable putting out there. And I don't know. I think there is something to that.
right.
Let's see. Is there anything else you wanted to share with everybody just in terms of, I guess, career advice is my last sentence. That a lot of people watching are in training or thinking about that. A lot of people are going to watch or
Yeah.
want to be doctors or in residency or medical school or fellowship. And you've had an extraordinary journey.
Oh,
You've trained
thanks.
at all of the best institutions and you've done a lot. I mean, how many years of training have you done at this point?
I've done well after medical school. It was another 11. No, after medical school, it was 7 years. So in total, it was 11 years after college. So after high school, it was basically 15 years. But I will say that I think that between all the fancy institutions, I feel like sometimes that's a little bit overrated. I mean, yes, some of these institutions are great, and there are a lot of great opportunities and people there. But I will say, like, sometimes the emphasis doesn't have to be on that. That's maybe advice number one. And the second thing is that I would leave some parts of the pathway to be left to chance. Sometimes over planning something can be a little too much, and a lot of the opportunities I've gotten have been just things that have popped up along the way, and one thing leads to another and might drive you down a whole different path. I mean, for me, I never expected social media to get to this point, at least like for myself. um, and a lot of these opportunities were just because, you know, yeah, like one thing led to the next, and that's sort of how it ended up, and I'm very grateful for that. And I can only imagine, like, when I think about where things are going to be 5 or 10 years from now, I can't even imagine like what's going to happen, because I feel like this is not a position that I thought I would be in 10 years ago.
Yeah, it does feel like there's this. That's wonderful, and thank you, because I think those are wonderful. As a psychiatrist, I think those are such wonderful pieces of mental health advice. Because when we think that the only place to learn to do X, whatever it is at this one institution, it's great to have goals and set your sights on this. But what's most important is you learning to do that thing that you're passionate about and want to do. And then that second point of just, which is so hard for people in healthcare, of letting our lives unfold and letting that kind of randomness of the
Yeah.
universe, and in some ways like trusting in it a little bit more than we usually want to in healthcare, because so many things go wrong and we see that. But that,
Yes.
putting in good work and being a professional and holding yourself to a really high standard, intellectually and academically, always leads to good things.
Yeah. And I think like some people who think that going to a super awesome, prestigious institution is like what makes them great. I think that it's the people themselves. What I've realized is the people I've come across there are really, you know, self-driven, and they're the ones who kind of are initiating all that themselves. So it really isn't the institution, you know, putting it into these people. It's these people coming up with it themselves.
Yeah, I think it was one of the benefits I had in my training. I trained at Indiana University Medical School, which it is true. I always like want to say where's that ranked, and it's the largest medical school in the United States,
Oh, wow.
but there's training sites kind of all over the state, and then you end up in Indy, which is kind of the mecca, where
Okay.
there's Riley Children's and all these great, Indianapolis hospitals. But it was fascinating when you get to some of these small places and you just meet exceptional physicians and
Hmm.
exceptional nurses, right? Who are just so good, and it really taught me very early on that, yeah, what really matters is is the attention to the craft, and certainly
Totally.
those institutions are great, but well, it's been such a treat to meet you for the first time and to talk to you. Thank you for sharing, and thank you for indulging me and sharing a little bit about your food and your mental health. I hope you get a little something out of this because you do deserve a little bit more self-care, Austin, because you got a lot going on, and so take good care of yourself this weekend.
Thank you. No,
And
thank you. It was so much fun, and it was great meeting you as well. I'm so glad I had a chance to jump on here with you.
yeah, everybody, this is Austin Chung, MD, and also check out his organization. He's the president of the American Healthcare and Social Association for Social Media, Healthcare and Social Media. And
Yes.
I'm Drew Ramsey, MD. This is the Brain Food Blog. We'll be back next week with some good stuff to feed your brain. And thanks everybody for all the hearts for tuning in from all around the world. And have a great week. And until I see you next time, everyone, please take care of your mental health. All right. I'll see y'all soon.